We had quite a good debate, and we had 4 main topics to talk about. One of them, and we spent a lot of time at the last table, was about communicable and communicable diseases. And actually now, the lines are blurring more and more, and non-communicable diseases, the example we had was obesity being described as an epidemic, and actually the lines are blurring more and more, and we should be focusing more about those conditions rather than necessarily HIV, TB or any other communicable disease for that. The other aspect we talked about as well was how being labelled with a diagnosis with HIV or TB in Africa, for example, was given, that you would then actually get a different level of treatment and funding because you had the condition, which then created a whole different inequality, whereas those long-term conditions of diabetes and hypertension that needed treating, which wouldn't get the same exposure. So that was another example. We had quite a good debate with regards to the lady from Turkey who talked about the impact of the war in Syria had on mass immigration and migration issues, which have now affected southern Turkey. That's right, yeah, particularly polio was the thing that they talked about. Netherlands, recently the outbreak of measles, particularly in the area they describe as the Bible Belt, and again because of cultural issues and their faith and what they interpreted of how they actually went about. So there were a couple of issues. Thanks.
Fantastic, thank you very much.
We talked about the role that family physicians need to have in educating patients, and also in community-based intervention, and how that can help poor people have better access to health and also learn more about health and how to be healthier. Also, we talked about the role of pollution, air and water pollution, and how sometimes the basics are really where we have to go first, like having drinkable water, for example.
A big key thing was the fact that many of the European systems are based on the desire for patients to have free at the point of access healthcare, but there hasn't really been the ideal manner to filter how patients access the different components of the system, whether they should go through the GP as a gatekeeper or be able to access the different components of the system independent of the GP. And then as well we talked briefly about the North American model of how if you have enough money you can pay for anything you want, versus the parts of the world where they don't even have doctors and they have low technology delivery of healthcare through healthcare workers. That all those factors interact together to give a very, very complicated picture of how you design a healthcare system that works for everybody. And fundamentally it's based around the fact that we all have to pay for everything somewhere along the line. So we had a very good discussion.
As immigrants as well, the problems with immigrants in every country, how countries have a lot of advanced attention to immigrants while others don't have the same rights for immigrants, so there is a need of global funds for immigrants and standardized agreements for all the countries.
Another discussion point was also the woman's health and safety. Also, especially in low-income countries, how can that be improved and should also be a part of the global health as well?
We talked about cultural diversity in health. It was a really interesting topic. And we came to the conclusion that cultural diversity, it's not only about different cultures in different countries, but we have to take into account that there are also different cultures when you think about age groups. So different age groups see things differently. And inside the same country, there can be various cultures. We had the example of the gypsy culture and how they perceive disease, and how what worries them is completely different from what worries us. So as GPs, we have, it's difficult for us to try to integrate all these different perceptions to their priorities and our priorities. So some ideas came up as to, should we integrate global health in the curriculum of GPs? And because we live in a global world, it's all about globalization. Immigrants, they They go from and forth.